Hey, thank you for joining me. I'm making today's video largely in reaction to the news that we're going to face stimulant shortages again this year, just like we did last year. I'm putting up on the screen a headline that raises this issue, but also poses the question, why are we having a problem with stimulant medications 2 years in a row? And the reason we're facing shortages again really comes down to two things. Number one is stimulant medications and the manufacture of stimulant medications are highly regulated at the federal level. So manufacturers can't just jump into the space and try and help out the supply. I think what that means is over the next year or two, the situation should improve, but not in the short term. And then the second issue is we're seeing a lot more prescriptions for ADHD being written. That's probably a good thing overall. The challenge is if that trend continues, we might have this problem continue for 3 or 4 years. And then one of the questions that my patients ask is, if there's shortages on one medication, primarily Adderall, why do I have a hard time filling my prescription for a different medication? And what that is kind of a downstream or a domino effect. If there's a shortage in Adderall, then prescribers like me have to get creative and write prescriptions for different stimulant medications to try and help somebody continue their care. So what happens is there's a knockdown effect that Adderall is in short supply, then the next one becomes in short supply and the next, and you end up having a hard time filling any prescription at all. So I hope that provides some insight into why we're in this problem in the first place, but now to what I think is probably the more important part, what can we do about it? And to answer that question, I think we have to talk about two topics. Number one is we should talk about all of the medications that we use to treat ADHD. That includes stimulant medications and non-stimulant medications. And then at the end of this video, I'd really like to cover some of the myths or misconceptions that people have around medications that we use to treat ADHD. There's a lot of them. And I think if we cover some of those, you might be armed with the information you need to go to your prescriber or to make choices that are better for you. Okay, so jumping into the medications. I'm putting up on the screen a list of all of the stimulant medications and non-stimulant medications that are commonly used. There's a lot of medications out there, but I don't want to give the impression that this list is exhaustive. It's not. People use a lot of different stimulant type medications and stimulants that are non-medications to treat ADHD symptoms. And we'll talk about that in this video. So talking about this list of medications, you'll notice it's broken into immediate release stimulant medications, extended release medications, and then non-stimulant medications. The immediate release medications are just the stimulant compound put into a pill or a capsule form without any kind of special engineering. The extended release pills are the same medication, but they're usually put into a delivery system that helps that effect last longer. For example, there are capsules that release a small amount of medication at a time, allowing that delivery to be extended over a number of hours. Then there's medications that are put into a compound that dissolves at a regular rate. So instead of immediately being released, it's released over time. But I want to be sure to emphasize that this is all the same medication, whether it's immediate release or it's extended release, it's all the same thing. With an immediate release medication, you might want to take the pill 1 time, maybe 2 times per day. With the extended release, you might be able to get away with taking the pill just 1 time per day. But otherwise, they're identical. I also want to call your attention to the green dollar signs. The number of dollar signs indicates how expensive the medication is relative to another medication. So there aren't specific dollar amounts on this graphic, but that gives you an idea which medications are more reasonable and which medications are super expensive. So now talking about the medications and the differences between them. Quite honestly, they're all almost identical. They all essentially work by the same mechanism of action. They enter the bloodstream, and then in the neurons, they cause the release of dopamine, which increases the amount of dopamine available to brain functioning. What that does is increases focus, increases concentration, increases alertness, but also a handful of side effects might occur as well, like reduced appetite, difficulty with sleeping, maybe increased heart rate. So when a patient tells me they like one medication a lot more than they like the other, usually what I'm understanding from that is the dosing was correct. So the dosing of this pill was better than the dosing of another pill they tried in the same category. For example, 1 capsule of Adderall at a certain dosage might feel better to an individual than a similar capsule of methylphenidate. But what I usually find is if I can dose the methylphenidate at a similar potency as that Adderall, the patient has essentially the same experience with the medication. It almost always comes down to dosing. So the way I suggest you use that information is the same way I use that information. If somebody tells me they do really well on a certain medication at a certain dosing, I can use that information to very likely find a similar effect with a different medication at a complementary dosing, if that makes sense. If on our first try to find the right dosing of medication we go too high, then you'll probably experience more side effects, possibly difficulty sleeping, reduced appetite to where it becomes more of a problem, a sense of nervousness or restlessness. Essentially the same thing as having drank too much coffee. If, on the other hand, we underdose, then there just won't be much effect and you'll probably feel like the medication doesn't work very well. But working with dosing, we can almost always get the effect we're looking for. And then moving to the non-stimulant medications like Strattera, there are a number of non-stimulant medications that kind of work in the same way. I just put Strattera on there as an example. While stimulant medications work by increasing the amount of dopamine available in the brain, non-stimulant medications work in a different way. They work by stopping the brain from destroying norepinephrine primarily, but also a number of other neurotransmitters, making those neurotransmitters more available to the brain as well. But the effect is more subtle. It's not as direct, and so you won't get that stimulant feeling you get with medications like Adderall or Metadate. And generally speaking, non-stimulant medications aren't quite as effective as stimulant medications, making them for a lot of people kind of a second choice. And then for a sense of completeness, I included the antidepressant medications on the list, not commonly used for ADHD, but they can be. Their use for ADHD would be off-label. So we've generally covered what medications we use to treat ADHD. There are more compounds, but they all fall into these different categories. And I'll dive a little deeper into this list as we talk about the myths or the misconceptions about treating ADHD. Now let's talk about some of the most significant misconceptions around the treatment of ADHD and around the medicines we use to treat ADHD. And if we're looking at these misconceptions, remembering that we're facing serious shortages of stimulant medications, one of these misconceptions becomes super important. That's the misconception that there are significant differences between the stimulant medications. There just isn't that much difference between them. And I recognize that that's probably a fairly controversial thing to say, but I'll tell you my opinion about why it's controversial. It's mostly because drug companies have heavily invested in the small differences between these medications. One delivery system over another, one capsule over another capsule, one compound over another compound, and that heavy investment equals heavy marketing. That heavy marketing goes to physicians and causes physicians to view the differences as bigger than they probably are. And to give you an example of this, if you take the immediate release medications that are generally cheaper and you administer them in a way that gives the delivery of the medication in roughly the same way the extended release medication works, the effect is going to be identical. And let me try and explain why that's so important. Most of us don't want stimulant medication on board all of the time. Most of us want to use stimulant medication when we need the focus, when we need to treat our ADHD, but thinking that we need to treat ADHD every day, all day, the same way, just isn't reality for most people. So for most people, having a prescription for immediate release medication that works for a period of time, and if you understand how long that medication works for you, you can take a second one if you want it to last longer. That's a pretty effective way to use these medications without having to dive into, number one, the expense of the extended release medications, and number two, the lack of availability. And to further make this point, stimulants that are not traditionally used for treating ADHD have been proven to be effective in treating ADHD. Caffeine in the form of coffee has been proven effective. Other stimulant medications like Sudafed or Pseudoephedrine that's used for treating allergies has been proven to be effective, and quite honestly, nearly as effective as the medications that have been engineered to treat ADHD. So just to be clear, I'm not suggesting that you stop taking a prescription medication and start using coffee, or stop taking your prescription medication and start taking Sudafed or pseudoephedrine, the one you have to get from the counter that they keep control of, not the PE form that doesn't work as a stimulant at all. What I am suggesting is to understand treatment of ADHD more accurately, stimulant medications and stimulants generally help ADHD. In fact, there are lots of individuals who just use over-the-counter pseudoephedrine to treat their ADHD quite effectively. So just to reinforce, I'm not at all telling you what you should or shouldn't do to treat your ADHD. What I'm trying to say is that stimulants, including prescription and non-prescription stimulants, have been proven to be helpful in ADHD. And that with that information, you can work with your prescriber, your treatment team, and come up with a solution that works for you when you go to fill your prescription medication and find that it's not available in your city. And the last misconception I'd like to talk about today is this idea that if you take a stimulant medication and you do better with focus and concentration, then you might have ADHD. The fact is, there's just no correlation between doing well on a stimulant and having ADHD and doing poorly on a stimulant and not having ADHD. Essentially, everybody performs better when taking a stimulant medication. This is why the military has been using stimulants for decades in combat situations, and jet pilots use stimulants almost routinely when they need to increase their focus and their concentration. And the military personnel and the jet pilots certainly don't have to have a diagnosis of ADHD to get that benefit from the stimulant medication. And I wanted to add that point for what I believe is a really good reason. We know from research on college students that a lot of individuals who haven't been diagnosed with ADHD are taking stimulant medications to enhance their performance academically. And with the myth of people thinking that if they do well on a stimulant medication, they probably have ADHD, we would have 70 or 80% of college students thinking they probably have ADHD. That's just not how it works. On the other hand, having a good reaction to stimulant medications doesn't mean you don't have ADHD. So you still need to go through the process of getting a diagnosis to know whether you have ADHD or not. That was a ton of information to cover today. Thank you for sticking with me through all of that. If you like the content, please hit the like button. And if you'd like to hear more content like this, hit the subscribe button. Thank you very much.